for the state health department to release a report which includes data on how many Texans are dying because of pregnancy or childbirth complications. Advocates will be rallying at the Capitol on Tuesday demanding the release of the data, which they say is critical. The health department first told KXAN investigators that the report would be released by next summer. As Arzo Dost explains, it's now expected to be out ahead of the upcoming legislative session.
State data on why Texas moms are dying and if those deaths were preventable has been delayed since September. But now the Department of State Health Services says it will be released sooner than expected. In a letter to State Representative Donna Howard, who is the chair of the Texas Women's Health Caucus, which focuses on women's health policy, the health department's new interim commissioner writes that she intends to provide lawmakers key data and recommendations in time to help inform efforts during the next legislative session. She says the Texas Maternal Mortality and Morbidity Committee meets again in December, and she will discuss this with them. She adds that the department will provide recommendations ahead of the session about how to make the mortality reviews more efficient.
Was that too late?
I think that it was due on September 1st, and that's by law. So there's a reason why that timeline exists. Currently, legislators are setting their policy agendas, as are other organizations that advocate for families and for health care.
Nakenya Wilson is on the state's committee, which is still in the middle of reviewing 2019 maternal deaths. She's also a founding member of the Maternal Health Equity Collaborative, which advocates to improve maternal health among Black women. They're demanding the data be released now.
And at this point, we're talking about using data to inform policy. And this is not just numbers on a page. These are lives of women who have died.
Wilson says the delay impacts better understanding of what's causing Black women across the state to have pregnancy-related deaths 2.3 times that of white women. She says that's according to older data from the state. She adds that a recent report by the U.S. Government Accountability Office, which analyzed CDC data nationally, found maternal deaths for Black women was disproportionately higher compared to other women during the pandemic.
The CDC provided a grant to the state to utilize a tool that helps us in our review process to be able to determine if discrimination was a part of a pregnancy-related death. And so this report will be the first report that provides that additional context of discrimination and any recommendations.
Arzo Dost, KXAN investigates.
The Maternal Health Equity Collaborative says beyond the data being released, the state also needs to extend Medicaid coverage to 12 months postpartum to better monitor a woman's condition before it becomes life-threatening. The group adds that Medicaid should reimburse for doula services and cultural competency training be required for medical professionals. Advocates and families will be at the rally on Tuesday at 11 a.m. at the south steps of the Capitol. How the state tracks maternal deaths and near deaths has been an issue KXAN investigators have detailed since 2019. For a closer look at our investigation and what to expect at the upcoming rally, head to KXAN.com and click on this story.